Good afternoon. How you guys doing? Oh, I really liked before the high five with the I love data. Maybe we should do that again. I knew I was amongst peers when I heard everybody get up and get really excited about that. Well, I'm really honored to be here this afternoon with a group of so many distinguished people who are focused on one of the most critical challenges and greatest opportunities facing individuals and communities, and that's improving our health. And by the numbers, Louisville has a lot of room for improvement. This is a graphic from the Greater Louisville Project, which is a consortium of 10 local foundations in Louisville that tracks and reports data against our peer cities. 16 different peer cities that have been selected because they share similar demographics to Louisville. And against those peer cities, Louisville ranks 9th in social economic factors as it relates to health, 15th in health behaviors, 10th in clinical care, and 9th in the physical environment. Clearly, we can do better than that. And we've actually made a public commitment as a city government to help our citizens get healthy. Now, this is a snapshot from the city's strategic plan. Interesting that our strategic plan is actually a website. It is not a document that was created and that is sitting on a shelf, but it is a living, breathing piece of information that each of the employees in city government use to guide their work. And that citizens can go to a website and see the goals that the city is trying to work against. Again, one of those goals is help our citizens get healthy. And annually, we track progress against this goal in particular. And there are a set of metrics that we're looking at, including the rankings against our peer cities and how healthy Louisville is, that we are trying to improve. And so today I'm going to share with you 3 different case studies or examples of how we have been working to improve the health of citizens within Louisville. And those are citizens who are also employees of Metro government, as well as individuals within our community. But before I get to the different case examples, what I'd like to share with you is a little bit of the background of the system that we've put in place to allow us to do this on a recurring basis. And so this is the performance and innovation system that we have in Louisville Metro government. It didn't exist 4 years ago, prior to the mayor's administration first term. It was something that we created because we recognized that there was not a way in which we could articulate what it was we were trying to do as a government, how well we were doing at it, and how we could improve. And so these 3 main questions that are on here actually shape the work of the office that I run, which is the Office of Performance Improvement and Innovation. And in the first bucket, what are we trying to do? That's where all of our planning efforts fall. And so as I said, we have a 6-year strategic plan that has a host of goals on those, one around health. And that plan has been cascaded into the work of all 26 agencies and departments within city government. And so we look at the progress against that strategic plan on a triennial basis and then share the results of that annually with citizens on that website. And it informs what we track in our performance management system, and that's the second bucket. How well are we doing? And so there we have a program called Louisville Statistics, or LouisStat. And through LouisStat, we don't only look at the strategic goals and the progress against those, but we also look at the operational performance of each of our departments. So how well are they doing at delivering services that they have committed to deliver to our citizens? Are they delivering them at a high quality with effectiveness and efficiency? And then the third bucket is, well, where we see if we're not meeting our goals, how do we close the gap? Either through incremental improvements or through breakthrough innovations to deliver things to citizens in a totally new way. And so one of the examples that I want to share with you is from our Public Works Department. They were one of the first agencies that we engaged through our LouisStat program. And one of the data points that jumped off the page at us was the fact that in some of the divisions within Public Works, over 30% of their employees, or at 30% had a lost time injury rate, their divisions had a lost time injury rate of 30%. So what that means is out of 100 employees, 30 of them were out of work due to injuries that they sustained on the job. So say that in another way, if you came to work, you had a 1 in 3 chance of getting injured on the job in a way that you would not be able to come back to work the next day. Now, this was an extremely high rate. And when we raised this to the director, he very quickly said, well, yeah, I know it's high, but we're a very physical department, right? Our employees are out on the streets day in, day out. They are lifting heavy objects. They are not sitting at a desk. So of course they're going to have a high lost time injury rate compared to other agencies and divisions. Okay. Part of our work with the Louis Stat program is to challenge our directors to find benchmarks. If you tell me that this is the industry standard for public works and assets and that other public works departments across cities and other private sector companies that do similar type of work have a similarly high lost time injury rate, then great. We'll work to continue to improve it and have it be the best that it can be. But if that's the rate that we're going to expect because of the type of work you do, then let's know that. And so our director went out and he looked at Bureau of Labor Statistics standards. He talked with other public works agencies in other cities across the country. And he also spoke with the private sector company that does waste management in Louisville. And he came back in our next forum and he said, I wouldn't have believed it had I not made the calls myself and known the individuals personally. But the waste management company that was operating in Louisville had a 0 LTI rate the year previously. 0. And he was dumbfounded himself. And so what they did was they benchmarked the practices and the policies that they had in place at waste management. And a couple of them, a return to work policy, which we didn't have previously, we put in place in Metro government. So if you got injured on the job and you sprained your thumb, you weren't out of work for a week or two until your thumb was fixed. You came back and did some other type of work that you could do with that limited capacity. We also, my favorite, put in place a safety program within Public Works and Assets that included a stretching program, right? So all of those folks who were going to get up at 5 a.m. and go out into cold temperatures and start lifting heavy objects, literally, right? They are stretching every morning so that they're prepared to go and have less injuries. But I think the biggest thing that data point did for us in that comparison was to change the mindset, right? Just the expectation that our employees, of course, are going to get injured on the job when they come to work. No, that should not be our mindset or our expectation. We should expect that our employees will not get injured when they come to work. And so it was a very helpful use of data to change some practices, some policies, but also the mindset of our employees and our director about what they should expect. Another example is with our EMS department. We were similarly working with them on their performance metrics, and they actually brought to our attention that there was a large variance in the time it took for their ambulances to turn out of the hospitals. So when an ambulance goes to a hospital, they have to transfer a patient, transfer the paperwork for the patient, and also clean the ambulance, prep it, and be ready to go back out to pick up another patient, right? Well, some crews was consistently taking them 40 or 45 minutes to turn out of the hospital. Other crews consistently taking them 25 minutes. Now, we looked, well, are the crews that are taking 45 minutes, dealing with the more complicated cases? Not all the time. Are the crews that are taking 22 minutes, are they shortcutting something? Are they not doing what they should be doing from a quality standpoint? No, didn't find any of that. So we put in place a team to do a project against this, and we used Six Sigma framework to do it. And it included going to the hospital emergency rooms and sitting there and observing the crews as they came in, seeing what they were doing, talking with the hospital staff, and basically trying to figure out what would be the right target for this. Is this something that we can change the variation in and bring that down? And so what we did was we set a standard after a lot of research about what would not hurt quality, but what also could be expected. And we said, listen, we expect that you're going to be able to turn out of the hospital within 30 minutes or less. And if you're not able to, we want you to report that to your supervisor so we understand the anomalies or the outliers for when we're not able to do that and why. We also talked to the administrative staff at the hospital to change some of the policies that they had in terms of how they received paperwork and prepped for our crews coming in. And, because everybody loves a little healthy competition, we posted the times for each of the crews at EMS. Now, we saw the time go down by an average of 10 minutes. And what this is looking at is the percentage of transports that are happening over 30 minutes. At one point, it was as high as 70% of the transports took longer than 30 minutes to turn out. At our lowest, it was 18%. And what that has done is meant that we actually have the equivalent of 2 additional ambulances on the street available to pick up patients who need them at no extra cost to taxpayers. This last example that I want to share with you is one that I'm really excited about the potential for, and it was one that I think Judith alluded to. So we have also, using technology, big data, citizen support and help, put GPS trackers on 1,000 asthma inhalers and given them to a pilot group of individuals who suffer from asthma. And our goal with this is to see when they are using their inhalers and where. And what it's done for us is given us a heat map that shows us where in the community and at what times those individuals are suffering from asthma attacks. Now, the work that we're doing right now is to overlay on top of this heat map, what's the air quality that day and time and location in the city? What's the traffic congestion look like in that area of the city? What is our tree canopy there? And if we have some insights into all of those things together, then we can start to make changes to the policies that we have within city government. Where are we going to plant trees? What types of trees are we going to plant? Are they going to actually clean the air and the particulates out of the air as they need to? How are we going to divert traffic flows, especially away from areas where they might really be creating a lot of congestion and hurting some of our citizens who have suffer from asthma and other illnesses? And so this, I think, is one of a great example of just how we're trying to use data within our community to inform the decisions and the policies and the actions that we're taking. We really are looking to continue to find ways that data, policy, process, everything can change the way that we interact with the community and the way that we help the community improve its health and we improve the health of our own employees within the city. Thank you.